Hi everyone, this is Melanie Schmidt, certified health coach and owner of Food for Thought. And today's Food for Thought is around digestion during pregnancy. And really this information can be applied to anybody, but I'm going to talk a little bit more about the pregnancy component. So digestion tends to be what I feel is the foundation of health. It's really the indicator of how is our body working and how are we releasing toxins and just overall our immune system and so much more within our body. It's a critical component. And if you have kids or you know a friend that has a child or has had a newborn, one of the first things we do after we have baby is we are monitoring that newborn very closely. Are they eating? Are they sleeping? And are they having dirty and wet diapers? And we look at that and we monitor to make sure they're having enough wets, enough dirty diapers. And that foundation of health really tells us how is their body working as a newborn. And very quickly we tend to kind of forget about that after they start hitting a little bit older ages. But what I want to recommend is kind of bringing people back to that whole foundation. How is your digestion working as an adult? How are your kids' digestions working maybe as a 5-year-old, a 10-year-old? Because it's a great indicator of how their immune system is working and overall how nutrients are being absorbed and just overall a good spot check for their overall health. So I highly recommend you kind of check in and create that awareness if you're not doing that already. During pregnancy, digestion tends to slow down. And most people have a slow digestion before they get pregnant, and then when they get pregnant it gets even slower. And there's multitudes of reasons why it gets slower. One of them being is the progesterone in our body. We have more of it and it slows that process down within our body. And so some simple steps to keep your digestion going, so you make sure that you're removing toxins so they're not circulating in your blood and then back into baby, is number one is making sure you're drinking enough water. So the rule of thumb is about half your body weight in ounces, but if you find that that's not enough, or if you're exercising, or if you are having caffeine, you need to bump up your water. So make sure that your water intake is appropriate. Each person is different, so become aware with what amount works best in your body. Number two, exercise. Exercise really helps our digestion get going, and it also helps our body prepare for birth. It helps us stay healthy, creates many positive things. So exercising, and it doesn't mean that you have to do an intense workout, but things like walking or maybe a spinning class, a bike class at a lower level, or yoga. All of those things really support your body, and they're a little bit more lower impact while you're expecting. Number three, getting as many whole foods into your body as possible. And what I mean by whole foods, I mean fruits and veggies. Obviously healthy fats and healthy proteins are very critical too, but really focusing on those fruits and veggies for digestion. They have lots of fiber, they have tons and tons of phytonutrients, thousands actually, that not only help your digestion, but also help baby grow and help you really fuel your own self so that you're not depleted from minerals and other nutrients that baby may take from you. Number four, dry skin brushing. Dry skin brushing is a great way to kind of get your digestion going. Our lymph system sits right under our skin, and so when we kind of rub and activate that lymph system, it helps activate our digestion. So there's brushes and there's gloves that you can use to do some dry skin brushing, and I encourage you to look it up on the actual technique of doing it, but it really helps if you do it once a day, maybe before your shower or your bath, and just to get that lymph system activated. Number five, got mixed up on my numbers. Number five, probiotics. Probiotics are so essential also. They are what you would consider your good gut flora, what is needed in our digestive tract to build our immune system, to create vitamins, to help move our digestion through. Probiotics are so essential, not only to digestion, but in pregnancy health overall. because baby is going to get our immune system, and especially during birth, pick up all those good bacteria and good gut flora in order to really have a good kickstart to health. And the last one tip I have is magnesium. Magnesium is a great trace mineral that does about 200 to 300 different functions in our body, so it has a huge role, and one of the roles is it really helps with digestion. So taking either natural calm, drinking that, or taking an Epsom salt bath, or using magnesium lotion or oil on your skin is a great way to get it into your body to help support a healthy digestive system, along with helps your muscle health, so that if you're having cramping, like leg cramps at night, it helps with that. It also helps you sleep better, and just so many more things. So hopefully I provided enough different options for you that you can pick a couple that resonate with you and try and see what works best for you. These are my top ones that have worked well for me and my clients. If you have more questions or would like more information about my products and services or additional videos, please go to www.food4thoughtdm.com. Thank you.